Hi, I'm Dr. Kaczynski, and this is Plastic Surgery 101, your internet source for all your plastic surgery questions and answers. Today we're going to talk about gynecomastia. Now, that is actually a Latin word that means male breast. So, why don't we just talk about the male breast or male chest. Now, this is a problem that is actually more frequent than you would think. It comes basically in two forms. The first form is in young men, usually around the time of puberty, when the hormonal surge occurs, basically a testosterone surge. The male breast tissue can respond to the testosterone in a paradoxical fashion. What that means is that testosterone is a male hormone, but in some young men it actually becomes translated or changed into a female hormone like estrogen. Or when it affects the male breast, because males all have a tiny amount of breast tissue, that this breast tissue actually responds to the testosterone surge by growing a little mound of breast tissue, which is usually around the nipple and is usually quite firm and hard. A lot of young boys experience this during puberty. Usually it's only on one side, and quite often it goes away. In a small percentage of young men, it doesn't go away, and it stays basically forever. And it does not respond to any kind of medication or other treatment. In the past, the treatment for this was surgical, and it involved making an incision around the bottom of the areola, or the pink circle, and through that incision the tissue was actually surgically removed. The little button, either the size of the areola, or it could sometimes be considerably larger. The problem with doing the surgery was, number one, it left a noticeable scar, and if there was extra skin, sometimes the scar was quite large because of the attempt to remove some of the skin, and it could also lead to a depression or a hollowing out in this area. So, since the advent of liposuction, many of these cases could be treated with liposuction alone, especially with special gynecomastia cannulas, or tubes that had slightly sharpened ends that could remove some of the breast tissue. And over the last, I would say, 10 years, I have not had to remove any of these with the surgical procedure, although there can occasionally be a case where the last little bit does not respond to liposuction and you have to surgically remove it. With the advent of the VASER, and especially VASER Hi Def techniques, it's much easier to break up this tissue and to remove it. Now that's in young men. In older men, something different occurs. And what that is that as men get older, they go through something similar to women. Women go through menopause, and men go through something called andropause. Or you could call it menopause. Same thing. Their testosterone levels drop. In addition, when the testosterone levels drop, especially if the man is slightly heavier, like most women, or excuse me, most men get at that age, then something else happens. The testosterone in the man's body is actually transformed again into estrogen. And this is done in the fat cells of the man by an enzyme called aromatase. So it's actually quite possible that a 55-year-old man can have higher estrogen levels than his wife. And those estrogen levels, again, can stimulate the breast tissue to grow. And in an older man, you don't usually get the hard, lumpy area, but it becomes more diffuse, and it becomes all throughout this area. And you also tend to see fat accumulation in through here. So for an older man, the ideal treatment is a VASER Hi Def treatment, because through several small incisions we can treat all of this breast tissue and fatty tissue, and also contour the armpit area. And once this is gone, that tissue stays gone basically forever, and it gives the desired shape. Without it, there is no diet, supplement, potion, lotion, exercise program, because a lot of times when people have these issues, they'll go on a big workout program, do a lot of chest exercises, and what it does is it builds up the muscle underneath tremendously, but does nothing for the overlying fatty and breast tissue. And the VASER Hi Def is the best answer to this problem, especially since it gives the best solution in the older man to the fat on the side, or what we call the axillary fat. So hopefully this has explained what gynecomastia is, what causes it, which is basically hormonal changes, either from puberty or from what we call andropause. The other factor that is becoming more and more prevalent is that we have a lot of estrogen and estrogen-like chemicals in our environment. They're in the water, they're in plastic everywhere. If you want to avoid this in your future, you might want to look at the source of water that you're drinking, and as the very simplest thing, just avoid drinking water out of soft plastic bottles, because that is a major source of environmental type estrogen-like compounds. And then surgically, there are options with minimally invasive treatments, both for the younger man and the older man. This brings us to the end of our tutorial. I'm Dr. Andrew Kaczynski of Advanced Concepts in Plastic Surgery, where art, science, and beauty come together for you. For more information, please come to our website, drkmd.com. Thank you.